Spinal disc issues are common. Nearly everyone will have them. And they are implicated in almost all forms of neck and back pain. Oftentimes, they are silent, silently there, waiting to attack us at our weakest moment. Now, neck problems, as you see in here, are exceedingly common. According to statistics, up to 70% of the people in the world will have neck issues. Those neck issues can vary in severity and in symptoms. It could be a mild stiffness in the neck, or it could be a discomfort that runs down the arms, burning sensation between the shoulders, can even cause, believe it or not, neck problems can even cause weakness in the legs. And as far as the back is concerned, statistically speaking, back problems are common in 80% of the people. It is said that at least 80% of the people will have back issues. And keep in mind, these statistics were published 10 years ago. Now, things have changed. They're saying there's no immunity. Everyone will have back issue. Be it mild, be it moderate, but it will occur. So the reason why I give these talks to help prepare everyone that are my patients, one, their loved ones two, and then the community, to know certain things so they will not fall a victim to neck and back issues. People are living longer. In US and most European cities, they have cities that people easily live to the 100. And in these cities, if they don't hit the 100-year birthday, they're surprised. Okay? And this is now in certain parts of the world. Japan has a few areas, US has them, many European countries have them. Pretty soon, within the next few years, it will be commonplace everywhere. So people are living longer. But what's happening is they're not living healthier. The last few years, and instead of being on cruises, vacations, are in waiting rooms of doctors and hospitals. Okay? So these talks hopefully will help you understand and narrow down why it's happening. But before we start our discussion on spinal discs, disc bulges, disc herniations, and disc damage, I want to go over quickly about the function of your spine. Let me use George so it'll be easy for you to understand. The spine has three main regions. The cervical being the neck, the thoracic being the upper and mid back, the lumbar being the lower back. And of course, you have your tailbone here, the sacrum, and then you have the pelvis on the side. Now, what makes this structure very important are these yellow outpokings, and these are the nerves. And those nerves need sufficient room. Ideally, the room required must be at least 4 to 6 millimeters in space. And according to studies, when a nerve receives 2/10 of a millimeter less space on it, when it's dented by 2/10 of a millimeter, that's a fraction of a millimeter, it produces symptoms, and it's predisposed to damage, degeneration, wear and tear. So your spine houses your nervous system. And these nerves control every organ, not just your arms and legs, your heart, your liver, lung, kidneys, your circulation, your nervous system, both sympathetic, parasympathetic, and autonomic and enteric nervous system. All the nervous system is controlled by the nerves that exit from the spine. The spine protects the spinal cord. Here are the 9 critical functions it performs. It performs more than this, the 9 most. It's a nerve pathway, a pathway through which the nerve exits. Connects the body to the brain. Your body and brain are connected. The brain is a central command. The body gets its information from the central command via the nerves. Your spine allows for mobility, and vast majority of that mobility is carried out not just by the joints, but most importantly by the disc itself. And that's why the disc becomes so important. And then facilitates the flow of nutrients that circulate all the way from your brain, all the way down to your tailbone, and that fluid is called the CSF. It's a clear fluid that nourishes and feeds the brain. Now, understanding the function of the spine is critical because we have to take care of it. It's not just for our back and neck, but it's also for our organs, for our nervous system, for our well-being, for our longevity, and for our ability that when we hit our 7th, 8th, 9th, and hopefully 10th decade and more of life, we're not dependent on our loved ones. And unfortunately, a lot are. This is why understanding spinal disc issues is important. So in this talk today, I will cover what you should do. Okay? What you should do to make sure, one, that you don't get spinal disc issues. Two, if you have them, to help you recover faster. And second, what won't work. These are the two most important things. What you should do, what won't work. Because we live in a society where anyone and their cousin can post anything on the internet and claim to be an expert. Many pretenders are out there which are actually harming people, which is why I started giving these talks. Because I've had a few of those come in, which is also why we started videoing for everyone else in the world. Now, we're going to start our discussion on spinal disc, but before I do that, to help you understand a bit more, let me get something so I don't point with my fingers. I wish I had a pointer, but I don't. We're going to go over basic anatomy of the spinal disc. I am going to pass one of these around, so for you to look at, and then pass back when you have finished with it, but also look up here towards me so you don't miss anything. The spinal disc itself is made out of two critical parts. The center, the gel-like substance, referred to as the nucleus pulposus. And on the periphery, the annular fibers, the annulus fibrosus. The annulus, or ring-like structure, although this image doesn't do justice because it's nearly impossible to configure something like that. It requires a lot of engineering, and I don't have those abilities. So I did the best we could with what we have. But in reality, it's not just as shown here, circular rings. These are crisscrossed, interwoven at 120-degree angle and held and tightly bound together. And purpose of this is to give it the ability, like a sponge in a spring, to expand and contract. Expand and contract. Now, this is a healthy disc. The center, gel-like, much like jello, very liquidish. The annulus fibers are tough, fibrous connective tissue. The inner part of the annulus resembles the soft gel-like center. The outer parts are harder and tougher. This is the main part. This is the heart of the disc. This is the disc. This one is a support structure to hold this in place, to protect it. Much like your rib cage, its purpose is to protect the heart and the lungs. The annulus, similar to that, is to protect the nucleus. But in addition to that, it also forms a connection between this bone and this bone, which is why many call the annulus a ligament. And in fact, it is. It is the largest ligament between the segments of the spine. Now, all of this is good, but what happens is that they can get damaged. It's not just the annulus that gets damaged. It's the nucleus that gets damaged. And what damages it is our lifestyle, our poor habits. And when that disc is damaged, we lose a lot of the functions that the disc provides us, enables our body to do. The bending that you do. A lot of people think, oh, that bending and that twisting is because of my joints and muscles. Yes, it may be. The joints and muscles do have a critical role. But the primary function of that movement is the disc. And again, the nucleus, the center, the pulposus, the main part of the disc. It's a cushion. It's a shock absorber. Earlier I talked about the annular fibers being crisscrossed, ring-like, 120 degrees. They expand and contract. So when you sit, it absorbs the shock. And that is needed because if the shock was not absorbed by the disc, every time you jumped, you damage your joints. and even the bone itself. And they did a study not too long ago. I take it back, 15 years ago. I think I read this study 15 to 20 years ago. That was an eye-opener. And we made a video on it. We made the video 15 years ago. The study was older. And how a disc is damaged. And there was an in vivo study. And this is a laboratory setting where they took healthy spinal disc motion segments, two vertebrae connected with a disc, from individuals who did not have damaged spines. That's pretty tough to find, someone that doesn't have a damaged disc. So I'm certain that they were younger individuals. So what they did is they took a collection of these samples and they put them in laboratory settings and pressed weight on top of them from different angles to see what happens to the disc. How much weight can the disc handle before it ruptures or breaks apart? Do you know what happened? They couldn't figure it out. And remember, these were healthy discs. So if the disc is healthy, that means the bone is healthy. You cannot have a healthy disc if your bone is not healthy, because the disc gets its blood supply from the bone. So the bone has to be healthy for the disc to be healthy. You cannot have an osteoporotic bone and then have a perfectly healthy disc. It's nearly impossible. So every time they did this test, they kept adding weight and adding weight and adding weight, and they had to stop. And not because the disc herniated, the disc ruptured or broke apart, because the vertebral body, the bone itself, collapsed. Every time. The researchers said, we wish we could have continued, but unfortunately we can't. It appears that the spinal disc is stronger than the bone when it is healthy. A healthy spinal disc is stronger than your bone. It can withstand a lot more stresses, much more than it's encountered in daily life. But unfortunately, even as strong as it is, we still manage to damage it. Supports the stability, nerve protection, mobility, all of that comes in. But what causes it to wear down? Even something as strong or stronger than your vertebral bone has its weakness. And it's our posture. And I'll go over this in detail in a bit. And it's important because I have talks on nervous system, I have talk on sleep, I have talk on posture, and we're going to have talks on myofascial and trigger points and many, many other subjects. And every talk I have given, and you have been to some of them, I tell all of the attendees that two things you should be mindful of most. Number one is your sleep. Number two is your posture. If you do these two well, you should not have much problems as you get older. And of course, diet, nutrition, exercise, all of those are critical. But they mean nothing if you're not having a good posture and if you're not sleeping enough. Those are the most two important ones. And those are the most two neglected ones. And the most common cause of spinal disc damage, according to studies published recently, in the past, in the last 30 years, there's thousands of them, maybe hundreds of thousands of them, is axial load bearing. What does that mean? Fancy term. Let me get my chair here so I can show you. Axial load bearing, meaning your body's weight coming down, much like this. And we talked in our posture class that sitting is bad. And there were some studies that compared it to smoking. That's how bad it is. Because it's not just bad for your disc, but in our case, for this talk, it's bad for the disc. But it's also bad for your internal organs. When you sit upright, the weight of the body comes down. And it comes down crushing on our spinal joints and on our discs. In this position, even if I attempted to sit in a perfect posture, my upper body's weight is coming down straight from segment to segment, all the way down on top of my lower lumbars. And there were many studies, and I will show you one that stood out. The amount of pressure it puts on us in a perfect posture is significant. It's 200 to 300 millimeters of mercury. That's quite a bit. And we'll discuss those in a bit. But what happens is, what's the most critical, is many of us lean forward and hunch down, working on our laptops, at our desks, on the computer. And up here, let's say, perfect posture, perfect chair, everything perfect. The amount of pressure on your disc is 200 to 300 millimeters of mercury. That's if you have a healthy disc. If you don't have a healthy disc, the pressure inside goes off. That's off the charts. But on a healthy person, what a good disc is 200 to 300 millimeters of mercury. Now, when you lean forward and work in this position, it can go 400, 500, or much more. That is why discs are degenerating. There was a study 10 years ago I read that shocked me, and by Robert Gill, an orthopedic surgeon, very famous. I think he's retired now since. So hopefully he's still alive. He's one of the best researchers. And he studied the cycles of disc degeneration. And one of the papers he published, he said that what was astonishing to him, and I didn't think anything would surprise him, said that 20% of kids between 9 and 11, keep in mind, this is at least 10 years ago, 20% of kids between 9 and 11 have early signs of degenerative disc disease. If that was 10 to 15 years ago, what do you think it is now? You can have degenerations. We all degenerate. Nobody continuously. We regenerate and degenerate. But some of us degenerate far faster than regenerate, and our bodies fall behind. It's because of our postures and things that we do. Degeneration is part of life, but it doesn't mean that as the moment you degenerate, you'll have pain. You can have degenerative changes in your muscles, in your ligaments, in your knees, in your joints, in your disc, in your nerves, even in your brains, but it doesn't mean that you'll be in pain because the body tolerates many, many times. So it can have a silent thing brewing there. The 20%, 9 to 11-year-old kids, they don't have symptoms. But those are the ones most likely to develop symptoms in the late teens, early 20s. And I have a lot of those patients. My youngest spinal disc patient was a 7-year-old girl. Wasn't a mild herniation. It was moderate, bordering severe. Only 7. She hadn't even hit puberty yet. Parents were shocked. Orthopedic surgeon, if you were in your 20s, I would recommend surgery, but at 7, I don't know what to do for you. So fortunately, we were able to help her out. So posture is the most important. We all have to watch it. And the same is true for the neck. You can have a neck issue and have problems. And like I said earlier, many that have disc damage do not have symptoms. It can be a silent killer. Now, here we have 2 images. Healthy disc, beautiful nucleus, oval shape. Annulus, perfectly bound, held together. Nerve, happy, nothing compressing it. Cord, widened, everything good. No pain, no symptoms. Healthy, happy person. The opposite, on the other side. You can see the disarray that the annulus is in. Fibers have torn. They're no longer holding the nucleus in the center. The nucleus, which is to be in the center, allowing proper movement, has migrated, bulged, herniated, or slipped, whatever term you like to use. It's pushing through towards the nerves. The reason why it pushes always this way and not so much that way is because while the annulus is a ligament that protects the nucleus, there's also another set of ligaments on the periphery of our vertebral body. And in the front is called the anterior longitudinal ligament, and in the back is called the posterior longitudinal ligaments. The front one, since it does not have any sensitive structures there, is much thicker, much stronger. The back one along the posterior is a thinner one because it cannot be too thick because it will take the room for the spinal cord. So it's a little weaker. The anterior and posterior longitudinal ligament serves as a secondary backup for the annulus and also a connecting point for the vertebra. That is the weaker point. So when disc damage occurs, and especially in situations where you have the annular fibers no longer bound together, torn apart, it migrates that way. And it causes the disc to get herniated. But that's not the worst part. Now, our bodies are aware of what's happening to us at every single moment of the day, subconsciously. It's a good thing it's subconsciously. Otherwise, can you imagine if your body told you every nanosecond what was happening to you? You would have a nervous breakdown. I know I would. Some of us don't want to know. So the body says, okay, we can tolerate this. No, we cannot tolerate this. Okay, this is not so bad, but it's getting borderline. When you have that type of a damage, eventually you will notice it because the body will have the nervous breakdown will tell you pain, pain, pain. Why is it painful? A healthy disc does have neuronal supply that has nerves. Now, the nucleus is here, and we have the annular fibers around on the outer side. The anterior and posterior longitudinal ligaments, the anterior one is in the front, the posterior one is in the back. Posterior one being thinner because of these tissues in here, we don't want to compress them. The front one is thicker. That also provides a secondary backup for the annulus, the annular ligament. Now what happens is that when these fibers tear, the disc herniates. It protrudes. The nucleus shifts its position from being in the center out towards the side. And as you can see in here, and it's at that point that it may become painful, especially when the tears all along the outer edges. And the reason for that is that the outer edges of the spinal disc has a nociceptive nerve fiber. Nociceptive nerve fibers are the ones that make you feel pain. They're the pain-sensing nerve fibers. We have all types of nerves. And this is a pain-sensing nerve fiber. It's a C fiber. It's fast, fast, fast. Lightning speed tells you what's wrong with it. A healthy disc does not have nerve supply that goes all the way down into the disc. It doesn't need. It just wants to know what's happening on the outside. If the outside is good, inside is good too. Now, when this disc gets damaged, these fibers also get deranged. They change. They get damaged. The borders become blurred. And even on an MRI, when you look at it, on a healthy MRI, you can tell the center of the nucleus as bright white on a T2F special view for MRI. And on the outer side, you can see that's a darker one. You can distinguish the difference between the nucleus pulposus and the annulus fibrosus. The reason why you can distinguish them, because of water content, mainly water, mostly collagen. Gel, tougher. So we can distinguish. However, when degenerative changes happen, the ability to distinguish between them is not possible because of the derangement. They resemble each other. It's hard to tell where one starts, one ends. It's not that the nucleus disappeared. The derangement changed its characteristics and therefore cannot be seen on an MRI. It still is there. But what happens, it gets damaged. And then the nerves. It knows what's happening. It has known for many, many, many years before you felt the first pain. The nerves starts to grow in to see what's happening inside. Ingrowth of the nerves, which makes it even more sensitive then. Which is why some of you that have annular tears, torn discs, when you're in the middle of the night and you turn, wakes you up. Common symptom. When you cough, it feels like a knife gone through your back. Some that have come, please don't make me laugh. Even laughing becomes uncomfortable and painful for them. Because every movement causes the torn fibers to vibrate. Any vibration in the body is transmitted through all tissues of the body. And if the disc is torn and there's excessive nerve growth into the disc because of the degenerative cycles, then it'll be quite painful. That ingrowth of nerve happens when it's asymptomatic. Because the body tries to fix itself. It knows that the disc is damaged, but it's not telling you. It's not telling me either. It understands that. So it puts in, let's go in nerves, let's find out what's happening. And you do one wrong thing, it tears, then it says, okay, this is the tipping point. We tell them we're hurt. But people don't listen. As I mentioned, internal derangement is common. Healthy disc, you can distinguish annular fibers. And that's important, because that holds this one into place. And here, the derangement. You see nerves in yellow coming in, and blood supply coming in. There's no blood supply past this point in a healthy disc, because the blood to this disc is supplied through the bone above via the end plate, which is depicted as this yellow part. The end plates get soaked with blood, and the disc sucks it in. And that process is called imbibition, which is why when you go to sleep and you wake up in the morning, you're actually measurably taller. Did you know that? You're taller in the mornings than you are in the evenings, which is why sleep is important. Why? Because when you're sleeping, the pressure, the interdiscal pressure drops down significantly, and the disc gets engorged. It sucks in. And it's great at sucking things. It just sucks in nutrients from where? From above and below. But when the disc degenerates, the body, the nervous system realizes that there's a problem. It doesn't tell you. It realizes it. And it tries to fix itself. The body is very smart. God is great. Give us the ability, our bodies, the ability to fix itself. But unfortunately, we're damaging it faster than our body can keep up. Okay? So what happens then is it realizes, nervous system realizes, this disc is deteriorated, this disc is degenerated. That means blood is not coming through. It's not getting enough nutrients. All right, capillaries, march in. Come on in. Let's feed this disc that is dying. It's like in the emergency room, Claire. That's what's happening. So you have vascular ingrowth, nerve ingrowth. And in some instances, it can help. And it still is, for many, asymptomatic. And at this stage, it can become painful. Now, I have a little video, a little short clip that I can show what happens to a disc, so you can better understand. This is top view, get it. It comes in, it compresses. And it can be various stages. This one shows a full herniation. I loosely use the word slip disc, but in reality, discs don't slip. I am guilty of using it because when I speak with people, oh, slip disc, I understand that. But when I say a fragmented disc or a ruptured disc or a protruded or a prolapsed or a bulge, they may not understand. And what is worse nowadays, especially nowadays, is when you open a radiology report, everything is either a bulge or a herniation or a prolapse. They don't distinguish the 7 or 8 different steps because it's nearly impossible. The only way you can distinguish, is this truly a bulge or is this truly a herniation, is to visualize the nucleus pulposus. But when discs go through degenerative changes, you cannot see the borders between the nucleus and the annulus. So the radiologist is not being wrong or deceitful. He just can't document it. So he uses the word bulge. But in reality, a disc bulge is a situation where the disc fibers are not as strong. It has swollen a little bit, but the nucleus has not migrated yet. It is a slip disc, but it's a contained slip disc. Contained meaning the nucleus is still in place. The outer fibers have swollen up. But you don't see that in radiology reports because it's very, very hard, nearly impossible, to distinguish that in most people. You can only see it if the nucleus is still relatively healthy and that you can see it migrating. But generally speaking, you can't see it, so they refer to it as a disc bulge. Now, after that is a prolapse and then a protrusion, and those are the early stages of non-contained slip disc, meaning that the nucleus, the outer wall, the annulus, collapsed. The nucleus migrated a little bit, changed position, but it has not ruptured through. It is still contained within the walls of the annulus. This particular one is called a herniation. Or another name for the herniation is called a ruptured disc, meaning the outer wall that is supposed to contain the nucleus in place have fallen. So technically, it's considered a non-contained slip disc. And you can have an extrusion with a herniation, which is even more. And then fragmentation, where part of the nucleus breaks off. And then the next stage after that is sequestration, where the whole thing chips off, and that is a surgical emergency. Even fragmentation is a surgical emergency. Maybe if it's slightly partial, you might have a chance, but I doubt it. That's very difficult. So those are important things that you have to realize. And I know it may be boring, may be tough to follow for some of you. And if you do have questions, I do realize that a lot of times people have questions, and I keep on talking, and that may not be fair. If you have something that you want me to elaborate more, just raise your hand, ask the question, and we continue. So that way, I don't lose you, because everything keeps building. So what I cover now, what I cover later, are all interrelated. If you get lost at this moment, you will not be happy with me later. A healthy disc is one where the nucleus pulposus is perfectly contained and stable. Ooh, I'm going backwards. Like this. The step after this is degeneration, where it will be disorganization, derangement, like this. It is not bulging, it's not herniating, it's not slipping. You cannot have a bulging disc, a protruded, a prolapse, a herniation, extrusion, any form of those disc damage without having degeneration, which means the annular fibers, the bond between them, are broken. And that break between the annular fibers could be significant. And if it's significant, it can be picked up by an MRI. Other times, because there are people that have, let's say, a herniated disc, but they cannot see the annular tear. MRI is awesome. It's not perfect. It is not that specific. It can see tears that are, let's say, 2-3 millimeters, maybe if it's a good MRI and at the right angle, but oftentimes it misses them. So you could have sub-millimeter tears at multiple points or throughout, and these annular fibers are held together by a compound called elastin, and elastin is everywhere. You know, this is the tissue that gives you elasticity, and this is also the tissue that gives you this. And this is the bond that holds these fibers together. Disc degeneration happens when elastin production minimizes, the disc is damaged, and those bonds break down. When that happens, then the disc is predisposed to the first stage in the slip disc cycle, which is the bulging disc. Okay? Then it starts swelling. Next stage, protrusion or prolapse, depending on who you ask, interchangeable. And the stage after that, herniation, which is same as a ruptured disc. After that is extrusion, which is progression. One stage follows the other, and the other. Now, the fastest I have seen in my practice was a patient that showed up here 10 years ago. He did the first MRI, and 10 days later had to do a second MRI, because after the first MRI, mild bulge, he had some back pain, went to a place where they did some aggressive things to him. It wasn't for him, it was to him, which is why I tell patients, be careful. His pain significantly increased, went back to his ortho, said, we got to do a second MRI because you're not the same person I saw a week and a half ago. And he wasn't. And I'm glad they did it. They did the second MRI. He went from a mild bulge to a severe herniation with a rupture. Spinal canal decreased in size by 75%, a significantly large herniation. He was told to have surgery. Unfortunately, he did not have the money, didn't want to do it. He asked for options, he searched, he found us. So it can happen. It can go, once you have a damaged disc, it can go rapidly, or it can take years. Now, Common symptoms, localized pain. Of course, the most common symptom of spinal disc damage is zero. And many of you who are my patients have come to me and I've told you that you have disc degeneration. I never had pain until last week. Based on what I see on an MRI, we can pretty much, at least I can guesstimate, take an educated guess based on its appearance, that this problem has been there, not for months, not for years, in most instances for decades. And that person did not have pain. So just because you don't have pain, it doesn't mean, oh, I can do all of these things because my back is perfectly fine. That's not correct. That's also the same for anything. Don't take it for granted. Because you can have pain, you can have localized pain, or you can have radicular pain. Radicular pain meaning if you have a disc problem in here that's compressing either your spinal nerve or spinal cord, you could have numbness, tingling, weakness, pain, discomfort in your shoulders, in your arms, in your hands, and your fingers. Between the shoulder blades, you can have numbness, tingling, burning sensation. One of the common signs that will tilt your head and neck up if you have experienced discomfort here, more than likely a pinched nerve, more than likely from a disc or spondylotic changes. Now, when, let's say you have a disc problem that's nasty and is pressing your spinal cord, not only will it affect your arms and your hands, it can go as far low as your legs. It can cause weakness, inability to walk, stand. It can cause digestive disturbances. It can cause palpitation in your heart. It can cause breathing issues. It can be a nightmare because your spinal cord here is important. It's important at every segment. It's most important in the neck. The higher up, the more important. Why? Because all of the nerves from this point on comes through there. So if you have a significant or a severe compression here, everything is impacted. So you have to be careful, which is why I tell everyone that are young, old, middle-aged, teenagers, stop doing this. This is a common thing. Mind your posture. Technique, they said, or technique. It's horrible nowadays. The generation that's coming behind us, the new kids, the teenagers and the ones behind them, everyone is going to have neck pain. Right now, back pain is the #1 health complaint in the entire world. Does not matter what country. Does not matter first world nation or third world nation. It's back pain. Neck pain is unseating it rapidly, quickly. And it's mainly because of our posture and our technology. So, we covered all this, but I'll quickly go over it so I won't bore you so much. We talked about axial loading that compresses the disc, that increases the pressure within the disc. Have any of you cooked on it with a pressure cooker? Anybody used pressure cooker? Or lived in a house where their significant other used a pressure cooker? Some of you may not be cooking. Well, the disc is a pressurized. Every single tissue in your body is pressurized. Even the air we breathe, our atmosphere is pressurized. Atmospheric pressure. I think atmospheric pressure is somewhere, I don't remember, about 700 millimeters of mercury. That's constant pressure in the air. So everything is pressurized. But the discs on the inside is also pressurized. And if that pressure increases significantly, it starts to break down from inside out. Much like the meat you put in the pressure cooker, you put on the heat, you turned it on, started boiling, steam is generated, pressure increases, meat tenderizes. It doesn't tenderize your discs, it destroys it. It breaks it apart, okay? And what happens, there's two things that happen with axial loading disc damage. Number one, of course, interdiscal pressure increases. The disc has a pressure, but the pressure in the disc has to be low in most instances for it to absorb nutrients that's coming in. If the pressure inside the disc is greater than the force of blood that's coming down, that nutrient that is present in blood have no way of getting into the disc. Imagine this. you want to get into this event. You are a pretty healthy looking guy and you think you can force your way through anything. But the problem is, at this event, they have a bouncer the size of Hulk. Okay. You ain't getting through. Okay. You ain't getting in there. You're not going to be in there. When the pressure inside the disc increases to that level, the nutrients that it can suck from the bone above and bone below is not going in. Too much pressure. And what makes that pressure worse? Sitting is, and all of those movements, which is why you have to understand. Mind your posture. And what makes that pressure drop down is rest, sleeping. And we will go over that, because when you are sleeping on your back or in a non-weight-bearing position, the pressure inside the disc is at 25 millimeters of mercury. I said the air pressure is about 700. Imagine, what is 25 millimeters of mercury? Nothing. It's really nothing. It's lighter than a feather. Which is why the force of blood, unless you have severe hypotension, that is less than 25, okay, the disc gets engorged. Which is why, when the pressure increases inside, the disc cannot bring in nutrients. A lot of times I have patients asking me, well, I heard glucosamine, chondroitin sulfate, MSM, hyaluronic acid, all of these things, stem cells and all that is good for the disc. Are they good for the disc? Yes, they are good for the disc. Can I take them orally? Can I do this and then benefit from it? No. It helps your muscles, ligaments, joints, but not the disc. Because the disc is a very unique structure. The part that needs those nutrients is the nucleus. That's the powerhouse. That's the manufacturing site inside the disc. But the problem is, the pores it has is that when a blood cell comes in, knocks on the disc's door, it could be carrying a ton of nutrients. The hawk standing on this side grabs the guy, takes his bag, throws it out, throws him in. The only thing enters the disc is oxygen, amino acids, sugar, and water. The blood cell gets stripped of everything else. And then the nucleus, it has chondrocyte cells inside, uses those nutrients to make the glucosamino products, the hawk to throw it away. So the disc has to produce its own building compounds. And it only does it when its nutrients coming in. Now, if the pressure inside builds so much that it forces blood out or prevents blood from being sucked in, what also happens, which is more problematic, is that pressure inside breaks down those chains of glucoamino products that the nucleus produced and ready for distribution. It breaks it to pieces. It gets degraded. That's called the agricon molecule. They get broken down and they're pushed out, treated as garbage, like throwing the baby with the bathwater out. And as a result, double whammy. The good stuff gets pushed out and prevents nutrients from coming in. Which is why fluid exchange is not in your favor. Now, I talked a lot about this, and we'll go over this again, and probably one more time. This is why posture is important. You have to understand what helps the disc. There's really no compound that you can take that boosts the disc up. It does not exist. If it does, science have not discovered it. I have not seen it in any research. But what was discovered about a decade ago, they did this, university medical students, I don't know why they would agree to have this done on them, but someone must have paid them well. They studied these healthy young kids to see what happens to them with different postures. And they had probes inserted to study the interdiscal pressure. And these are medical students that did that. I don't know why. That must have been paid a lot. They found out in a supine position, because back when they did this research, it was widely accepted that the best position for you is on your back. Now it's debunked, the best position is on your side. But we go with this. And the reason why? It's non-weight bearing. No pressure coming down. Interdiscal pressure is not increasing. The disc pressure is minimal. 25 millimeters of mercury. I say, okay, that's good. Yes, it is good. What happens when you stand? And these are young individuals, so they can tolerate a lot more. Maybe for them, but not for me. Not for most of you. Standing, 100 millimeters of mercury. That's 4 times the amount. Leaning forward, like the Muslim prayer, or anytime you lean rolling, that moment. 150 to 200 millimeters of mercury. You can say almost 10 times. Sitting, 250 millimeters of mercury. That, 400 and over millimeters of mercury. Day in, day out, day in, day out. There's no nutrients entering in unless you have hypertension maybe there during the day. Okay? If you don't have hypertension, more than likely it's not even coming in there. So nothing is coming in. Very little is coming in. If you're doing a lot of bending, nothing is coming in. If your job is sitting all day long, your disc is not getting rehydrated. The only chance you have is sleep, which is why I say pay attention to your sleep. Make sure you sleep well. You have to complete the 6 cycles of sleep, at least 7 to 8 hours, uninterrupted. So what happens? Disc pressure increases. The good nutrients gets leached out, broken apart. What you need to come in does not come in. Your condition progressively worsens. You can have pain at the very beginning here. If you're not lucky, you can have pain way past this point. Some are even unluckier. They have no pain. I've had many patients come in, and I had to convince them, sir, that's a disc problem. Their only complaint is about, my legs are weak, but I have no back pain. That's not uncommon. Early onset, most people will have some stiffness. We said that the disc has nociceptive fibers. But when the disc tears, guess what happens to the nerve? That also gets damaged. And if there's a lot of interdiscal pressure, that nerve eventually degenerates. It stops working. No signal going in. Dead nociceptor. So no pain. No pain, more gain. You have none in this instance. You have no pain, but you don't have any gain because now you have no warning system. Pain is not a bad thing. Ignoring pain is bad. Pain tells us what's happening. If it wasn't for pain, instead of cooking my soup, I'd be cooking my hand most of the time. And I've injured my hand many times. Ask my wife. She's sitting in the back. And my kids are happy because they say, every time I hurt myself cooking, either burn, I cut. And I do that almost every time I cook. They say, the food tastes nicer. Oh, you must have hurt yourself. What do you mean? Tastes good. I guess when something bad happens, something good also balances out.
No question.
Yes, sir.
Lying on your back.
Mm.
Just how you make a comparison with a good sleep like 6 or 7 hours per day. But can that be compensated with just lying down, relaxing without not sleeping?
Okay. I tell that the same thing. You can. It would be better for your disc, but not for your sleep.
Yeah, because sometimes even when you sleep, your posture might not be right.
Even if your posture is not right, because the weight is not coming down, the interdiscal pressure is not rising, even bad posture will have benefits versus standing and sitting. Of course, the best posture is, it's important to follow postural position, but the most important thing is to make sure that you are continuously sleep
Rest.
and
Let's say,
asleep for at least 7 hours.
let's say for some reason you don't have a good sleep at night.
Then you have a
Can that be
problem.
compensated with just lying down
No,
and relaxing?
no. See, you have a bank account. We all do. You can deposit money in the morning, money in the afternoon, money in the evening, and the next day you say, all of them adds up. That's your bank account. Your sleep bank does not count that way. It's all or none. You cannot make up for what you've lost. Sleep goes in cycles. For you to benefit, you must go through cycles. 1, 2, 3, 4, 1, 2, 3, 4, 4 cycles. If you wake up in middle, that is interrupted. You have to start all over again. The main thing, as far as the disc itself is concerned, when we were talking from the aspect of hydration, to making sure that the disc gets filled in with nutrients. Just being in a non-weight-bearing position is better than standing or any of the other postures, even if you have a bad sleeping habit. But if you have a damaged disc, then of course you want to make sure that when you're sleeping, you follow proper posture. If you sleep on your back, yes, a bolster under your knee, a pillow under your neck to support this curve right here. It's very difficult to find the right pillow. I always tell patients, roll a towel, put it right under you, here. And it's healthier because then you can wash it and get a fresh pillow every night. Now, that's sleeping on your back. But the best posture for your mind, for your heart, and for your spine is if you sleep on your side. And there was a study done not too long ago that was published within the last 1 or 2 years that sleeping on the side is best. But sleeping on the right side is most important and best for the brain. And the researchers said, we don't know why. Because the right side of the brain and left side of the brain are identical. We do not understand why sleeping on the right side is better compared to the left side, for the brain that is. But it is better. So until they find out why, sleep on your right side. But when you sleep on your side, you have to make sure when you sleep on your side, your spine forms one line. You cannot have a bent neck. Now, let me get George Jr. here. I named them all. George Jr. is sleeping like this, twisting. Okay. Many times I ask patients, how do you sleep? Some say on their side, some say on their tummy. And I always ask those that they say on their side, so how do you sleep on your side? And they show me. They're like this. Ma'am, you're not on your side, you're on your tummy. You think you're on your side, that's twisting the spine. Not good. Now, the stages of disc damage, we've covered this, we're going to cover it again. Healthy disc, damaged disc is a stage of degeneration. When that happens, directly after that, it gets damaged and then degenerates. It doesn't go, technically speaking, a damaged disc is a degenerated disc, but in order for it to be degenerated, it must first get damaged. And how you get damaged? Posture, injuries, repetitive habits, things that you're not supposed to do, that you do, that we do, that I even do, and I know better. Okay? And it's not just me, it's everyone. We all have bad habits. Once it gets damaged, the disc starts to lose height, lessens and lessens and lessens. Now, critical part of the disc that I mentioned, that I said earlier at the beginning, that the disc, one of the functions is to protect this nerve. And I think a disc protects nerves? Yes, it does. Not just nerve, but also your cord. If it wasn't for this disc in here, this bone will be on top of this bone, and that hole where that nerve comes is going to be half the size it should be. So the thicker, the fatter the disc, the more room for this little nerve. So you don't want, even if you don't have a slip disc, you don't even want the degeneration. You don't want the loss of height. And it's easy to see. For instance, if we see a patient with an MRI and all that, you can pretty much see which discs, measure the top, measure the bottom, one to the other. Ideally, in a perfect situation, the lower back, as we come down from the mid part of the back, right below the ribs, each disc that comes down and lower, each disc should be slightly bigger than the one above it. Boom, 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 all the way down, because more weight is coming down through here. So it needs more substance, more fibers. The discs in your neck have those rings that we talked about, the annular fibers. The discs in general have between 15 of those rings to 25. Neck bone, 15. Lower back, the big ones down here, maybe 25. Some can have more, some can have less. But it has to be thick. Why? You need that. You want that bounciness. Now, in the lower back, the two most important segments, they're all important. Not that one is less important, more important than the other. The two most important ones are the lower two discs. The disc at your L4, L5, and the one at the L5 is one. S1 meaning the tailbone. A lot of people don't realize this, that bending at the waist. When I ask them, where is this happening? It's like, in my hips. That's wrong. 95% of this movement is at L4, L5, which is why the most common spinal disc bulge, herniation, protrusion, slippage is at L4, L5. Second most common, L5 is 1. Third one, L3, L4. But this is on average. There are some people that there are variations of it. Some can have it at L3, L4, and I've seen it in L4, L5, and L5 is 1 perfectly healthy. That's the posture. They're slouching badly. They're putting their weight. They may look comfortable when they're sitting. They're sitting like this, more than likely. The weight is coming down through there. So they will have middle and upper lumbar issues. Now, and of course, as the disc wears out, if this space is not there, the joints, facets, they are going to be compressed more. They wear out too. Then you have two problems. A disc degeneration with bulge and herniation, and arthritic formations. It's called a facet hypertrophy. And then as this disc wears out, there's a little ligament in the back, a beautiful ligament called ligamentum flavum, the yellow ligament. It connects on the inside of the spinal canal and on the back between the vertebrae. And its main purpose in life is that when we bend down and when we come up, there are guardrails. So our joints don't jam up. They allow us to move and keeps these joints stable, which is the reason why they say, when you lift, use your knees and not your back. Which is why I tell patients that when you go to the gym, do not do deadlifts. And if you have to do deadlifts, make sure you get paid a lot of money. They're like, why? Because you're going to need that money to fix your back. It's like playing Russian roulette. Because what happens when you do deadlifts? You will use your legs, but you will use this. And that ligamentum flavum is going to thicken. It's called a ligamentum flavum because it resembles more a ligament than a muscle. But it's the only ligament in the body that has contractile abilities. And I suspect the only reason why they're not calling it a muscle is because when the person who first named it realized that there's no tendons. So it became known as ligamentum flavum, or the yellow ligament. But it has contractile. It's ligament because it connects bones. It's also muscle because it has contractile abilities. And the only other muscle in the body that you don't want to be thickened or hypertrophied is your heart. Your biceps, beautiful. You want it thickened. You want to hypertrophy it. You want to do that really well for these muscles and these muscles, but not this muscle, not this connective tissue. So if, let's say, you're very careful, you didn't do anything, that ligament didn't thicken, but if the disc degenerates, it's a situation where that ligament buckles. It's called buckling of ligamentum flavum, which means if it buckles, it goes inward. It cannot come outward back here because it's bone. It goes inwards towards the spinal canal. And that will be a second source of compression on your spinal cord or the sensitive nerve that traverses through there. So the disc protects not just the cord, but also the nerves. And that's what you have to realize. And sometimes when I say that to patients, and sometimes even people in healthcare disagree with me, I say, hey, look at this, this makes sense. You have to pay attention to the mechanics, because if you don't understand the mechanics, you will not know what to do for it. I'm going to beat this to death. Healthy disc, healthy fibers, healthy nerves, all beautiful. Next stage, a bulge, disorganization, the nucleus, derangement, cracks in the annulus. The fiber may still be intact. It may not be pinching the nerve. Stage after that, a protrusion, a prolapse. but still contained. In other words, yes, damage in the annulus, but the nucleus has not broken through these fibers. But they're bulging more, compressing. Stage after that is a rupture. Rupture is also herniation. That's a trigger word. That means something broke through, tore apart, it's ruptured. The nucleus pulposus ruptured to the annulus. This is the most dangerous. And of course, it's difficult to see it on an MRI, because on an MRI you cannot distinguish, in most instances, between a healthy nucleus and a healthy annulus. They all look black. Now, on an MRI, it's very difficult to say, is it a pure herniation or is it just a bulge? Technically speaking, it's not possible unless the MRI clearly shows where the nucleus is. And the vast majority, I would say, and over 95%. I've done this for 30 years. I started viewing MRIs. MRI has been around since 1982. The first MRI was an MRI of a heart. And the poor guy who invented it died almost broke. But that's a separate story. But MRI became commonplace in the US in the early 1990s. I think it hit Malaysia right about year 2000 or so. So I've looked at a lot of MRIs, and I don't think I was able to see it in 5 MRIs that this is the nucleus is coming down. It's very difficult. Maybe with the newer generation of MRIs in about 5 to 10 years, they can distinguish, but current MRIs cannot, especially if it's not a powerful MRI machine. So what I do instead, and sometimes, yes, under reports it's herniation, and in most instances when they say that, is because they see the appearance of this, a focal jutting through of something, a focal protrusion, or a point that where things is coming out and dangling down. Sometimes it's an extrusion with disc hanging down below. It's like a sagging disc. It's not just come out, it's also sagging down. Then you know that's the nucleus because it's the softest sagging. If it's annulus is firm, it doesn't really sag. Then you can say it's a herniation without seeing that. So that's difficult. But you generally use that. But it doesn't matter. Anytime it is compressing, it is not contained anymore, or it's compressing the nerve, it's a problem. Now, I put them in a row for you. The good, the bad, the ugly, and the gangster. Okay. None of these are good. And in life, we can go through all of them, or just a few of them. You could be in this stage and could have back pain. You could be in this stage and have zero back pain. You could be in this stage and still have no pain. And even in this stage, you could be and still have no pain. Pain is not a yardstick. Pain is a symptom. Sometimes our bodies communicate, other times it doesn't. So you have to be careful. And a good example is me. I've been treating people with knee pains, back pains, joint pains for 30 years. I thought my knees were perfect. I went for walks, more walks, and more walks, and more walks, and more walks. And then I changed my shoes. That was the stupidest mistake I made. I always said Nike, but this one time I was out shopping, I liked the other brand. It looked good. I bought that one. It wasn't Nike. I know I'm not getting paid by Nike, although they should pay me. I wore my new shoes and went on walking and walking faster and faster and faster. And one day I developed pain. It got so bad that I couldn't walk. Like, what the heck happened? I went to Colombia, Asia. The radiologist there, good guy, very smart boy. I had him do an MRI. He called me back and said, "What did you do?" I said, "What do you mean?" He said, "It doesn't look good, man." I said, "What do you mean?" He showed me. I had zero pain. My knees have stage 4 degenerative changes. Cartilage loss, bone spur, meniscus damage, ligamentous issues. And I thought it looked good, but it wasn't good. So I stabilized. And I showed you last time, I can do this. but my knee is damaged. My body is not telling me, thank God. But I wish it had early on. Then it wouldn't be in this stage. So the same is true for many of you, which is why you have to be very careful with what you do. They say, watch your diet, not because you're going to have problems. Watch your diet because you don't know if you have a problem. If you don't watch it, then you're going to have a problem. What they say? You can hide, but you can't get away. Eventually, it will catch up with you. It's like playing Russian roulette. I have done it 5 times. Well, the 6th time will get you. It's a losing battle. So it's best. I didn't know I had any problem. I honestly didn't. Had I known, I would not have done that. Which is why now I'm going to go over some of the things that you shouldn't do. I have a lot of patients whose family doctors, even their spine surgeons, and even the chiropractors, physios have told them, sir, swimming, very good for you. Yoga, all the yoga gurus on Facebook, yoga this, yoga cures sciatica. If you have spinal disc damage, swimming is not good for you. And people are shocked. Swimming is an excellent exercise. Right, lift, legs kicking, pelvis turning, all that bending, twisting, excessive motion, which is why you feel good when you go for laps, 20 laps. And that night when you go to sleep, oh, it's hurting. Next morning it hurts more. You know swimming wasn't good for you. So if you have spinal disc damage, don't go for swimming. It's better to walk in water than swim in water. No twisting, no repetitive movements. Yoga, wonderful. Thousands of years of history has done wonders for many. But when yoga was invented, average life expectancy was 30. By the time someone hit 30, either someone killed him or something ate him. Okay. So back then, and it's only the last decade or so, people are living into their hundreds. So if you're in your 40s and 50s, even if you don't have pain, I would say don't do yoga. And if you do yoga, don't do excessive bending. If you have this problem, do not do yoga at all. Even if it feels good. A lot of things feel good in life. And I jokingly tell patients this. And they kind of laugh. And sometimes I have to be a bit funny so I can make the point. So you know why drug addicts do drugs? Because it feels good. So if life was all about feeling good and no other problems aside from feeling good, then everybody will be doing them. Aside from yoga, things that won't help. General stretching. And I've seen chiros, physios, and a lot of other pretenders that give advice. Stretch this, stretch that, stretch your hamstring, stretch your neck, do this. If you have a disc problem, you do not do that. The action of this, you're stretching the muscle on this side. What is happening to this side? The joints are getting compressed. Now, George Jr., come to me. I don't know. I bring it closer. Let's say this guy bends to this side. Bends to this side. The joints are compressed on the side towards which he's tilting, which I'm tilting too. The pressure on the disc forces the disc to go that way. If there's a weakness, it can increase the herniation there. If there's a herniation on this side, you do this, it pinches that bulge, that protrusion. Can end up with a fragmentation or partial tear. So what may feel good for the muscle is not good for the joint or disc. And above all, when you do stretching or exercises, it has to meet 2 criteria. Condition specific, age appropriate. If you're in your 50s, this should not be done, even if you don't have disc damage, because more than likely you have some level of spondylosis. I have not seen anyone in their 50s and 30 years that did not have some measure of spondylosis or some measure of disc bulge. They're common. They occur. But they are asymptomatic, so not a problem. Strengthen, but be careful. Stretch, but don't do too aggressively. But if you have a fully blown slip disc and a symptomatic, last thing you want to do is general stretching. And a lot of these guys show this one. Put your knee over here in your upper body, and all of these YouTubers. They give these fancy, fancy exercises because you like to watch them. They don't care about you. They care about watch hours. Another misconception is heat, 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 everything. Yeah, why heat improves blood flow? Yes, it improves blood flow. It also increases inflammatory processes. And one of the first things happens in disc damage is inflammatory reactions inside the disc, which is what degrades it, but also in the tissue that connects around your spine, and even in your facets. And that can be seen on MRIs. It can be inflammatory processes in the muscles, subcutaneous, right in the erector spinae, the multifidus muscle groups. You can see that on MRI. But still they see it, it's there. Their therapists or doctors are telling them, heat pack. Why? Because it feels good. Well, life was all about feeling good. You can also do heroin, cocaine, marijuana. Oh, we got to edit that out. So those things are not good. It wouldn't help you.
But sometimes when they give you therapy, they kind of give you cold therapy and then laser, which is kind of...
Laser is a little different, which is good. Okay? That's a different type of reaction. It's a deep penetrating. Hot pack is superficial. It doesn't penetrate deep into tissue. Laser can penetrate up to 10 centimeters down. Right. Okay? And that heat is not produced because of a mechanical hot pack. Okay, because laser itself is cold. It's because of the interaction it generates and deepens into tissue. Right. And even ultrasound does that. It has a little bit of heat, okay, but it penetrates deep. Superficial heat, which is through hot packs, is not good for you. Okay? But mild warming with laser should never be hot. It should be mildly warm. If it's hot, it's cooking you from inside out. Okay? So some forms deserve, but the heat that I was talking about, hot packs. If you have disc damage, if you have an inflammatory process, if you have a facet inflammation, swelling inside your facets and your joints, you don't put a hot pack on it. And some of the other things, bending forward, we talked about this already. Do not bend. Do not twist. Do not lift and carry in these postures. These are all bad, and more bad. Not good for you. It damages your disc. Now, enough of the bad news. Now, most of you have heard the term sciatica. Sciatica, sciatica, sciatica. What is it? Sciatica is a loose term. It's not a condition to me. It's not a diagnosis to me. It's descriptive of a symptom. It means the sciatic nerve is inflamed. The sciatic nerve is the longest nerve in the body. It originates from this nerve, the fourth lumbar nerve, the fifth lumbar nerve, the first and second sacral. And some people, there are variations. 4 nerves from the lower back. Sometimes could be 5, but very, very rare. It can start as early as above as the fourth lumbar, but for some it can be L3, but those are also rare occurrences. There's some anatomical differences exist, but generally speaking, I would say 90% of people, L4 to S2, 4 nerves. Combine, form, goes back here, under the buttocks, down the leg. Sciatica is not a muscle issue, it's a nerve issue. And that issue often and always comes from a compression that exists oftentimes in the spine, resulting from a slip disc. Symptoms: pain down one leg. Usually sciatica, by definition, is on one side. But it can happen both sides, but they don't say, oh, that's not sciatica. Well, it is sciatica, bilaterally. Yeah, that's happened before. But one side will predominantly be more painful than the other. Then it turns into numbness and tingling and eventually becomes weak. Sciatica, the number one issue, is due to compression of the fibers that form the sciatic nerve. And the most common cause of a sciatic nerve disorder, sciatica. Sciatica means the sciatic nerve is inflamed, not happy. But when you trace it back, as I said, the sciatic nerve, it gets its name as a sciatic nerve in this point in my buttocks. Because fibers from here two fibers from here. They come together, form one bundle, go down through here, under my buttocks. And at that point where they form one bundle is then referred to as sciatic nerve. And it goes down behind my hamstring, right directly behind my hamstring, right about here. Then it branches out, multiple fibers going all the way down. Okay? But the word sciatic nerve is up to here. Then all after this point where it branches, each one has a different name. But the important thing to realize that sciatica, to me, as I said, is not, it's a cop-out diagnosis. Because it's not telling you, it's just telling you your sciatic nerve is not happy. That does, to me, purpose of diagnosis is to tell you exactly what's happening with that patient. Sciatica is too loose. But what they say now, based on studies, at a minimum, 95% of all patients with sciatica have a spinal disc issue. I happen to disagree. I happen to believe everyone with sciatica will have a spinal disc issue. I have not seen a condition where there's a sciatic nerve or sciatica-like symptom and there's no disc damage. In every case that I have seen a sciatic nerve patient or a disc patient that comes in, there's some disc involvement. But degree will differ, could be from mild to moderate. Now, there's the most important thing that you have to realize for sciatica is that when, as I said, that it's from a disc, but it's not going to be just involving your disc. It can also trigger muscle reaction. Our muscles are covered with fascia. The muscle and the fascia that it's covered with, especially in the back, in the buttocks, down the back or side of the leg, these all get their neuronal stimulation, their nerve supply, from the lower back, from the same fibers where the sciatic nerve comes from. So if the nerves in here are irritated, these muscles, including the ones on your bum, the hamstring, the IT band, the calf muscles, they all get irritated too. When a muscle is irritated, it can contract. It can be spasmodic. It can stay tense. And over time, then that becomes a problem in itself. You develop trigger points. And that will make this worse, and this will make those worse. And if that goes on, then you'll have myofascial pain syndrome. The fascia that covers the muscle also gets damaged. Everything is supposed to be elastic. The elasticity is gone, so the stretchability is gone. The tissue covering the muscle is damaged, the muscles inside is damaged. Those two damage combined is going to make your sciatica worse. And when it comes time to get treatments, you got to address all of those issues. Which is why a lot of times when I say, is it painful here, is it painful here, I look for those trigger points or myofascial points. Because addressing only this part and not here, it's not helpful for you. And you have to be careful not to do things that would make it worse. The do's and don'ts. A reminder for you all. Maintain good posture. I don't want to talk about posture anymore. I have published a lot of posture talks, shorts on YouTube. You can watch them all. There's about 9 or 10 will be. Watch them or come to a posture talk. That's even better. Take breaks. Also in the posture talk. He stood up, took a break. Wonderful. When you're sitting for a prolonged time and no movement, pressure builds and builds and builds. Just getting up and walking around mobilizes things. And when you get up, put your hands here and feel how much movement there are right in your spinal column, right next to your fingers. You will notice it does one of these things when you walk. Every single joint in your body, where the sutures in your skull, the joints between your toes, the joints between your spinal segments, with every step, they mobilize. And it's good for them because it detoxifies them. It depressurizes them. Mobility is good. So take breaks. Sleep on your side. Right side is best. But right side is best only because it's good for the brain. What's good for the brain is good for everything else. Because the brain covers everything. And again, we're back to this one. We went over this. Does anyone have any questions before I move on? This is just a reminder to get you. Now, what to do? Let's say you have a lot of this fascia we talked about. Muscle cramping. So I told you, said, don't stretch. Yeah, don't stretch the wrong way. Exercise and stretching, in order to be beneficial, has to be condition specific and age appropriate. Two of the things that most patients miss. And it's happened before. I did inappropriate exercises and my knee got smashed to smithereens. Okay, talking about I did exercises. I did this so I can show you. Fascia is important. Muscles are important. Not that it's not as important as, let's say, your disc. Your disc is most important because it protects nerve, canal, CSF flow, everything else. But if you have disc problems, if you have a nerve impingement, you will develop muscular issue. You will develop problems with your fascia. And if you don't fix those things, it will never recover, which is why they do trigger point injections or myofascial injections. It's injecting different parts. You don't need to go that. That's crazy. You don't need to go that route. But they do. And a lot of people are doing it. And they are getting results. But there's also side effects. So, a good stretch to do. You have to break that. Only when you're ready. If you're not ready to do these exercises, you create more problems. But there has to be fascia exercises. There has to be stretching of muscles. This one, I'm pointing here. This is for the psoas. Psoas sounds horrible when I said it once and someone said, what are you talking about? My bum is not sore. And no, it's not. It's psoas with a P. So we're not talking about, this is the different type. This is a muscle. It's a major hip flexor. It attaches under your belly, spinal segments here, and down to the hip. Big muscle, two of them, major and minor. Main job is this. But if this is not doing good, nothing will. And everyone who has back issues will have a psoas issue. And you need to stretch it. Aside from it, there's psoas release techniques in physio and chiro. And our physios does it. I've done it for many. I did it for you earlier. Okay? It's not comfortable, but it's needed. Why? Because when you release this, yes, it's not part of the sciatic nerve. But the entire body is connected. It's part of your pelvis. When this is tense, you will have a tilt. That will impact sciatica. What happens here is not isolated. This impacts this, this impacts this. Yin and yang. Muscles have agonist, antagonist. For every movement, there's an opposite muscle that does the opposite. Psoas is this. So you have to stretch it. The best way to stretch it is to, I sat on a small little stepping stool and I pushed and leaned back. If you're not ready for this and you do this, you'll have a lot of pain. And if you have a spondylolisthesis, a situation where the bone also slips in addition to the disc, you have no business doing that. So when I recommend these exercises, it's not for everyone. Make sure, if you're my patient, we talk, we tell you. If you're not one of my patients, you talk to your doctor and you make sure it's done, it's specific for you before you just, he talked about it in his talk. Not just because I talk about it, it doesn't mean it's right for you. These are good exercises, only if it's appropriate for you. So yes, while this is good for certain instances, it's bad for others. If you have a stable sciatic and stable disc, in other words, you're stabilizing and now you want to make sure you don't go through the same thing, because recurrent neck and back issues are common. Over and over and over, they get better. They say, it's coming back. I thought I was over it. No, as soon as you get improved, you get over it. That's not when you're, okay, I'm going home. No, the game is not over. That's when you start these things to make sure it doesn't come back again. Okay, this is good. Psoas stretch. Quadricep stretch. You hold. This one you kind of lean back a little bit. to get the psoas going. This one is mainly for front of the thigh. So it's, as you can see there, did this, and then you push back until you feel the burning, the stretching, but not that level. A little bit. Hamstring, nothing too aggressive. A lot of times people say, oh, lay down, pull your leg. That's going to be too excessive. The sciatic nerve goes down the back. You pull it down like that, it's going to stretch and it's going to become flared up. These are relatively safe, even though they're relatively safe. Do not do them until you check with your doctor. Oh, you see me next time. Now, earlier we talked about that there's no nutrients that's going into the body. Into the disc, sorry, not body. Nutrients go into the body all day long. But the disc, everything is stripped out. But you want your body stable, strengthened. I usually tell patients, these are my darlings. These are the darlings of the vitamin family. Do not take them just because I say they're the darlings. Check with your doctor first. But I highly recommend that you take them after you check with him. And if he doesn't agree with you, then go check with someone else. He may be outdated. There are a lot of people out there outdated. Some of the doctors are very anti-vitamin and supplements, and that's shocking because research proves it's good. Vitamin D3, the darling of vitamins. If you have a skin my color, you need this. If you're a Nordic person, meaning so white that you look like a ghost, then you may not need this so much. Just 5 minutes in the sun is enough. The darker you are, the longer you need to stay in the sun. When I first came to Malaysia, I was shocked to see. I've seen people carry umbrellas in the rain. But the very first time in my life I saw people carry umbrellas when it's not raining was in Malaysia. I was like, huh? And they go, oh, from the sun. Sunbrella. That's the worst thing you can do for yourself. And it's even more so problem among the Muslimas. Because Muslims have to cover up. They get even less. So you need the vitamin D. But vitamin D by itself cannot be taken. Even if you take it, you'll have expensive stool. It won't be absorbed so well. You need to take it with a K, K2, full spectrum, so it can be digested. But even then, that's not enough. You need to take, also add in magnesium glycinate. They all work together. There is not a process or an enzymatic reaction in the human body that does not depend on this one. And if you don't do them all together, and also none that is non-existent, every enzymatic action in the body needs this. But to get these two in, you need this one. Just this and this. This by itself, you may absorb a little bit. When you take it with this, a lot more. But when you take it all together, significantly more. And it varies from person to person. But one of the first things, nearly everyone on this God's earth is deficient in magnesium. And glycinate is an easy one on stomach. A lot of you, or a lot of people that have disc problems, will end up having weakness. Okay. And weakness to a point that where agility becomes an issue. As we get older, balance is critical, because if you lose balance, you can fall. And as we get older, our reflexes slow down. I don't have the reflexes I did when I was in my 20s, 30s, or my 40s. If I fall now, I'm not going to be able to react fast enough to break that fall. I will fall hard, and I will hit hard, and I will get damaged badly. So everyone that has the slightest bit of weakness in their legs, or anyone over a specific age, need to do some proprioceptive exercises. This is wonderful. Wobble board. We recommend it to many of my patients. And it's important because exercise stimulates your nervous system and it communicates with your brain. Your brain then orders muscles to contract. It reestablishes the brain-body connection, improving one and the other. You want to stand on it? Okay. I don't want to embarrass myself. That's a rocker board. This is an easier one. The wobble board has a round bottom. It wobbles everywhere. This is much easier. I can show off with this one. Wow, I'm talking big now. If I fall, come and catch me. So what you do is you get on here and you try to stabilize. And see, my body's going back and forth. And this is automatic process through which my muscles, my brain commands muscles, different points, to balance me. So I'm going back and forth. And then when you get really, really good, and if you want to intensify this, you stand with one leg, and you hold. This is much harder. Because you see, I am going in all directions, balancing. And when you master this, then you get on that one. And that one has various levels. This was invented in the 60s for people with ankle problems. And also surfers loved it in the 60s because in the winter months they would do this, and in the summer months they had better balance. What they found out, everything else improved. That's how it made it from ankle problem to the entire nervous system, because it improves the brain-body pathway. Whether it is an ankle issue, a neck problem, this will stabilize. Proprioceptive exercises is critical. And it must be part of every rehabilitation program. Without it, you're going to fall a victim to recurrent neck and back or joint problems. Exercises, as I mentioned, must be age-appropriate, condition-specific, and only done when you're ready. This one, even the rocker board, it looks easy, it looks simple, but you can't fall from it. You cannot. People go, well, can I take that home and I do? So what happens if you fall at home? Who's going to catch you? You need to do it at a clinical setting so they can hold on to you. Don't try to do it by yourself. That's why I told them, if I fall, come and catch me. But you run away. Thanks for giving my back. Now, whether you have sciatica, disc bulge, disc herniation, yes, depending on who you go to. Some people will say, I'm going to crack your back. Others will say, I'm going to grab your neck and yank really hard while my body pulls on your ankles. And some will say, no, we need a little bit of steroid injections. Others will say, you need a little surgery. I wouldn't recommend any of those. The cracking and twisting, even if it's done by a very well-experienced chiropractor, should not be done on the spine that has a damaged disc, because it will tear that spine apart. I am not a big fan of rotatory chiropractic manipulation. I only do them when I am 100% sure that there's no spinal disc damage. And you know how often that is, that I'm 100% sure that there's no spinal disc damage? Almost never. Because how can you be sure? So it's better to be safe than sorry. So some people have surgeries prematurely, and yes, they do operate, and some will have significant successes at the beginning. If you read researches published online or through journals that come to your house, if you subscribe to them, but I don't think any of you do, but some online may, you will realize that they say laminectomy, discectomy, frontotomy, this fusion is 90% effective, 95% effective. And one of the bogus things that they talk about is the nucleoplasty. 95% successful. Success is a weird, weird word. If you look at the definition from linguistic point, from medical point, from legal point of view, they all are the same. Success is defined as any measure of improvement. Let's say your pain, you rated it 10 out of 10. It couldn't be any worse. You came to me, I did treatment for you, and after the treatments, I say, rate your pain. You say, 9.99. I was successful. And I can claim that by any definition. But it wouldn't be successful to you. So you have to read that with a measure. I would recommend do not do invasive procedures. Not that they shouldn't be done. Yes, they have their place. There are times I cannot help. I say, sir, too late for me. You go talk to the surgeon. But even Harvard Medical School, Cleveland, Mayo Clinic, they all say one thing. If you have spinal disc issues, even if it's a herniation or bulge, surgery should be your last option. Exhaust, conservative route. Now, conservative route does not mean you go to the tip place, crack your neck and back. Get someone to do Thai massage on you, or get your kid to walk on your back. Okay. Or get these guys to poke needles in you. It has to be condition-based and appropriate conservative care. Ones that don't harm. Okay? And then, on top of that, conservative care is not just that. In a day, there's 24 hours. I see a patient 30 minutes, 2 hours. What about the other 22 hours? You have to mind your posture, your habits. You change now. I think I went well over what I was supposed to. I don't know what time it is. I told everybody it will be over by 7 o'clock. What time is it now?
7:58.
I am very sorry.
But we thank you because
I,
It was 6 to 8.
oh, thank you very much.
Yeah.
All good is from God. And thank God that made it easy. I hope you understood well. I know it's a complex and complicated. If you want to come to any of these talks, even if you want to come 15 times, I don't mind. The more you come, the better the changes. So start making these changes now. Because if you wait, oh, I'll make the changes when the pain goes away. Guess what? When the pain goes away, you will forget about these changes until the pain comes back. So it's best to change when you're hurting. Any questions, anyone? No? Yes, sir.
Just on the neck problems.
Yes, sir.
Obviously, it starts here. You said it's probably the worst place where it starts
Yeah.
because everything else is connected. If you have neck problems, I mean, any obviously other than the fact that you come to this practice and get treated, but any recommendations that you may have how to just generally take care of it when you're not being treated?
I would say the most important, where you do treatments or not do treatments, you have to make lifestyle changes. Sleeping posture, sleeping habit, diet and nutrition, and how you use your computer, your setup workstation, the position your monitor is in if you're using computer on day in, day out basis. Yeah, treatment you may need. But if you fix everything else, you may not need the treatment. You may not need me. Even if you need me, if you don't pay attention to these things, it will not work. It's like buying a sports car and not having a driver's license. The most you can do is wash it and wax it. And enjoy looking at it. But same thing for your neck and back. The most important thing is not the treatment. The most important thing is to make lifestyle changes now. When it's early. When you get that done, then everything else is easy. But if the pain is so significant, start the treatment in combination with simultaneous habit changes. And it's not going to happen overnight. It's going to be tough for you. And it's not going to be easy, but you have to make changes. The sooner, the better.
Yeah, I mean, do pillows make a big difference to?
Yes, of course they do, because they keep your neck in perfect position, but there's no perfect pillow.
There is no perfect pillow.
Unless you're a billionaire and you can spend a couple of $100 million on a pillow that's for a factory that can make one specific for you.
Yeah.
Then there's a perfect pillow.
As a rule, should it be a very firm pillow or a moderate pillow?
No, a soft pillow. Can you get me the pillow too, better than that? The towel, the white towel somewhere around. Where's that white towel? Is it in one of the rooms, right? Can you guys get me that white towel, please? So I can show. Oh, it's over here. I'll bring it. I had it here from my last talk. You were there? These are not bad. I have not found the perfect pillow yet because it doesn't exist. Put them here, sleep like that. Usually Contour pillow has two sides, a thin side and a thick side. Sleep like this. This one, both sides are about the same. Maybe this side is a little thicker, but not a significant difference.
Yeah, the only problem is,
They'll move around.
yeah, throughout the night, you kind of move around and you don't know where you are. So that,
I am like that, but some people are blessed, and I'm related to a few of them.
yeah,
They wake up and they fall asleep in the same position.
yeah.
Me, on the other hand, at least I don't fall out of the bed anymore. Thank God for that. So, if you're like one of those people who don't move a bit, this is perfect. You tie a ribbon at each end. You make it, you put it under your neck to protect that curve. This is good. And it's soft. You know, and every week you can throw it in the wash. Unlike this, becomes a bag of germs. Because we sweat.
All the latex ones are probably,
Those are the best ones. If you can find one that has a latex inside and then covered with memory foam,
memory foam.
that's perfect.
Yeah,
But they're not cheap. They're expensive, but they're worth their weight in gold. If you can find that, but make sure there's a thin side and a thick side.
you know, your answer has to be positive, not negative. So,
Yeah.
So I just warn you before I ask the question. So, what is your views on golfers who golf regularly, and A, how bad is it, and B, what can be done? I mean, look, golfing ranges a lot because you go from a good swing to a bad swing, and the bad swing guys tend to injure themselves a lot more because they don't understand the game. Fortunately, I'm on the other side where I understand the game because I've only played it 30, 40 years. So, however, I just wanted to ask, you know, what's your thoughts? Because there is a lot of contortion. As you know. You know, you do need to kind of move it from here, and you don't load up before you come down. So there is a contortion of the spine.
Not a problem.
Just wanted to get your thoughts on it.
There is not a sport that can be done or physical activity that can be done that has no harm.
Right.
You have to, everything in life, you have to look at the good and the bad. Golf is amazing. I have my priorities all screwed up. I don't play golf as much as I should. I used to be very good at it. I would play twice a day. And I moved in an area right on a golf course, and it's free for the residents.
Wow.
And I'm 200 meters from the first hole.
Right.
And it used to call my name, and it still does, but I turned my ear, like, not today.
Yeah.
And it's been 5 years, not today. So I got my priorities screwed. That's good to know that you don't have your priorities all screwed up.
No, but we're you know, like you said, we're addicts. So, you know, we've gone beyond that point.
Golf becomes a religion, but it's the best thing you can do. Don't stop. Don't stop. Don't kill the ball.
No, absolutely.
You go to the range, do not hit more than 50 balls.
Correct.
And if you do hit, if you go to the range and hit, use your 7, 8, 9 wedge. And don't kill the ball.
No, absolutely.
Okay? Nice and swing, and don't go pching like KLGCC. I used to love going there. I tried to beat the machine, it would pop up the ball for you.
Yeah.
I couldn't.
Yeah.
It's great exercise, but it's horrible for your knees and back. That's probably why my knee got destroyed. GCC, drive range. I used to go 200 balls in less than 45 minutes.
Oh, that's bad.
That was great. A great workout.
I mean, over the years, obviously, I've completely dropped the rate. Yeah, I just go chip and putt, but other than that,
That's it.
I don't hit balls.
Don't.
I only play on the golf course.
That's it.
Yeah.
Go on a golf course. Why? 1, vitamin D. 2, exercise. 3, fresh air. And most important, your eyes. We need to look at green, dark, fresh green. Greenery stimulates your mind. This is why golfers, when they come home, they're happy.
Yeah.
They've had fresh air and they've looked at green all day long.
Yeah.
I'm not talking about the color of money.
Yeah.
I'm talking about the color of the trees and the grass.
Yeah.
And Malaysia is the perfect place for it. Got the green in here, so vibrant.
Yeah.
That's perfect for the eyes, for your nerves, for your brain. So don't stop playing golf. Just don't go crazy.
No, absolutely.
What was it? A Rodney Dangerfield movie? You may be old enough to have seen that.
Which one?
Rodney Dangerfield. Do you remember the golf? Played golf. You know who he is?
No. Rodney.
Rodney Dangerfield. His name, the actor's name, with Chevy Chase and all that.
Oh, yeah.
They made a lot of golf movies. He always said, "Beat the ball, beat the ball, beat the ball.
Yeah.
Don't kill the ball, beat the ball." So, beat the ball. So, in other words, be gentle. So the ball is your buddy. Beat the ball, don't kill it.
Yeah.
Don't swing hard.
Yeah, and is there some sort of a warm up or stretch up you should do so that
Gentle swings.
Yeah, that sort of stretching and yeah. Okay.
Avoid bending and twisting. The stretches that I showed there,
Yeah.
those are perfect.
Okay.
Walk around, do gentle swings.
Yeah.
I see golfers taking 5, 6 clubs. I say, what are you doing?
Yeah.
You're all worn out before you get to the tee box, and then you hit it 100 meters. So you, man.
Okay. Well, that's great. I'm glad you kept a positive note. Because my wife is sitting here and it would be
See, he's got his priorities straight. This fella.
No, but honestly, we really enjoyed your talk, and I think it was very, very clear, very informative, and we
Thank you.
thoroughly enjoyed it. It was very educational. So
I'm glad to hear that. It makes my day.
yeah,
That's why I do it, because a lot of people need to hear a lot of things.
Yeah,
No, it's
Yeah.
excellent.
Thank you.
Excellent.
excellent. Very,
Thank you. I'm glad. And thank you for coming.
Thank you so much.
Have a good
Oh,
day.
you missed the short talk.